Can I use 2 words?
Trying to describe a technologist in 1 word is really difficult because of so many different roles that you get to play.
It's a Forrest Gump kind of thing where every day is like opening a box of chocolates. You just don't know what you're going to get until you're there.
It can be challenging. As a technologist, it's a challenge to come in. It's a challenge to come in and balance your technical expertise with patient care. But that's the fun of it.
General public, usually they thinking technology is just like pushing a button, and they don't know that it's actually a degree now.
I think one of the challenges that imaging faces is the constant perception that all we really do is take some pictures. The JDMI staff are often faced with very complex situations, and they consistently rise to the occasion.
Our goal is to obtain the best possible images for the patient to ensure a correct diagnosis and also give them the lowest possible dose for their test or procedure.
The various diagnostic and therapeutic roles include imaging patients, looking for function of the body, how the anatomy of the body looks and works.
You get such an extensive training about when you're working with radiation. You have to be aware of that when you work in nuclear medicine, you're thinking about the radioactive nuclear material. You're always thinking of making your X-ray field smaller. Same thing with CT, you want to cut down on the X-rays.
We do the views that are required by the radiologist, and we also check the patient's histories to make sure that we're not repeating things unnecessarily.
I want to talk about my personal cancer journey and the incredible work that the Joint Department of Medical Imaging is providing to me. I was diagnosed subsequently with nasopharyngeal cancer, which is a cancer in the nasal pharynx, located sort of at the base of your skull. This is probably one of the few times that I've actually experienced the full gamut of services that have been provided by medical imaging.
JDMI technologists and sonographers will see patients repeatedly throughout their care pathway. It's the work that they do that really drives what the decisions that get made regarding a patient's care, as well as whether or not that patient is in remission or whether or not that issue or problem at hand has been effectively dealt with.
Turning to the technologists, they are an incredibly important part of this particular process because they form part of the diagnostic and the planning process for the treatment that I ultimately received. They took the time to explain to me what type of imaging I was receiving and how it would ultimately play in my course of treatment.
Your patient needs support. You need to explain to them what you're doing. You want to explain the technical aspect of what you're doing and making it very easy so they understand, and we work as a team because it is a partnership with the patient.
Excellence in patient care, very simple. I mean, it means treating every patient that you encounter as though they were your mother. I wouldn't want my grandmother or my mother being treated in anything but the best amount of respect, best amount of care, and the best amount of thoroughness and integrity that I could possibly direct towards them. That's the care I would want to give to a relative, and that's the care that everyone should be getting.
Your technologists play an important and integral part in making sure that you will get the best care possible.